Dr. Linda Park here. Thanks for tuning in. Today I'm going to do a video series that's going to explain a lot of my motivation as a dentist and why I do what I do. You know, all of us are motivated by things that have happened to us in the past and things that have shaped us. And I became a dentist because I believe that all of us are made in God's image, and I want to share God's love with other people and help as many people as I can achieve the genetic potential that God intended. But man has gotten in the way over the years, and industrialization, modernization has caused a lot of problems that have opened our eyes to it's not just about teeth, which I learned about in dental school. It's about so much more. And in 2017, the American Dental Association said that as dentists, we need to acknowledge and recognize that the airway is important to consider. And that was brought to light to me in so many ways. And some of the reasons that brought me to where I am today are the fact that in 2008 I had breast cancer. And then after that, I was dealing with my youngest son, our youngest son, who had airway issues at night, and I didn't know it. He was a mouth breather and a thumb sucker, as were all three of my boys. And we were never trained about any of that in dental school. It wasn't a topic of discussion, even in the orthodontic department. So I didn't realize that my son getting up at night and having night terrors was causing his anxiety and his large tonsils, and his mouth breathing was affecting the shape of his jaws. So those are things that, after I started learning, needed to be dealt with and were contributory to where he was, that I realized I need to figure this out. So that caused me to really open my eyes, look around, and learn from different people than I had previously learned from in dental school and even after. Because dentistry and so much of medicine is dealing with the symptoms and trying to treat the symptoms without dealing with the root cause. And what we now know is that there are many symptoms, and I'm just going to read off a list here so that I capture a lot of them and relay them to you for you to understand. So some of the symptoms are crowded and crooked teeth, open mouth posture or mouth breathing during the day or nighttime, snoring, grinding teeth at night, bedwetting, getting up at night to use the bathroom, night terrors, sleep apnea, pacifiers or sucking your thumb after age 1, because that can reshape the face and the teeth and the jaws and everything. Difficult behavior, ADHD or hyperactivity, headaches, back pain, and body dysregulation. All of these things are symptoms that different patients of mine have and need to be addressed. And we don't just address crooked teeth. We don't just address bedwetting. We don't just address behavior. All those things are addressed by looking at the cranium, looking at the airway, and looking at the shape of the jaws and the function of the tongue and the mouth and chewing and breathing. All those things play a vital role in solving the symptoms that we see every day. You know, 1,000 years ago, our ancestors did not need braces. And now we're in the 70 to 90% range of people that need orthodontic intervention. And we're sicker than we've ever been. So we have to go back to basics. But we have to now use modern techniques to get back to basics and solve root problems that are causing these symptoms that we see today. So these environmental challenges have caused epigenetic changes that have affected the cranium and the occlusion and the body. So I've talked about it before, and you can refer back to some of my previous videos, but there are things that cause injury to the cranium and cause these sutures and the relationship of the bones to change. So birth, being hit or have blow to the back of the head or the side of the face or the front of the face, and even things like chewing, swallowing, tongue on the floor of the mouth only when it's really meant to be on the roof of the mouth. God created our tongue to be an expander so that when the upper jaw is expanded properly, the lower jaw gets to be the size that it's supposed to be. But if we're not chewing properly, if we're not functioning properly, if our tongue is on the floor of the mouth or it's tethered or held back, it's going to hold our jaw back. And what happens when our jaw is back? Our tongue goes in the back of our throat. And then we have airway problems that I see all the time on my 3D x-ray. So I'm going to discuss today, because a mom had asked me to do that, to discuss the various ways that I can address these oral dysfunctions, cranial strains, and the root causes of these symptoms. So these environmental challenges cause a vicious cycle of vertical growth because, as I said before, the mandible, the lower jaw, is going to be held to where the upper jaw gets to develop. And if you don't develop the palate with your tongue, then it's not going to be wide enough for this lower jaw to fit well. Or sometimes the lower jaw grows bigger because the upper jaw is restricted, so that's an underbite. And without jumping into all the details, which you can learn about in previous videos, it's basically just environmental factors epigenetically changing the way we get to function and causing all the problems. So if we talk about sleep, for example, when there's disrupted breathing during sleep, the body perceives it's choking. And so what happens? You're in fight or flight all night long. You're releasing cortisol, and the brain says, I need oxygen. I need to breathe, because the most important thing that you do in life to begin with is breathe. So the body reaches out for help, and the brain reaches out for help, and it causes the patient to clench or grind their teeth. So we see a lot of grinding, and people say to me, if I snore, how am I clenching and grinding because my mouth is open? Well, it's this cycle that gets set up because your brain that needs the oxygen says, please deliver some oxygen to me. So it will grind to bring the jaw forward and allow for the airway to be open. So this is a summary of the orthopedic options that I offer here at Park Dental Wellness. There are 5 different ones. And the reason that I have chosen these is because I feel that they are the most effective and will vary from patient to patient depending on their needs to give them hope and help them achieve their genetic potential. So the 5 different ways that I approach orthopedically helping patients is MyoMunchie and MyoBrace, light wire appliances like the ALF and Broderson Crozat, or regular Crozat, Nuvula, which is an Italian ortho system, very innovative, the open loop Cricket, and working with AIA, or the Applied Integration Academy. There's a physical therapist that I use on the other side of the state, and with the 2 of us working together, we use the ALF appliance and a PATA, which is basically a bite splint that helps the body to balance and feel safe and grounded and heal some of the body issues that patients experience every day. Thank you so much for taking time to watch this video. I hope that you found it helpful, informative, and really expanded your ideas and opened your eyes to the different ways to treat a patient and solve some of these symptoms and root causes. If you did, hit the like button and subscribe for more great content.